College. Representative Kelly for 5 minutes for questions.
Good morning. Excuse me, it's an honor for me to be here. I have been at the forefront of the battle to raise awareness about the maternal health crisis, shining a light on the alarming rise in maternal mortality rates, especially among Black women nationwide. It's clear that assaults on abortion and reproductive rights directly affect maternal health outcomes, as we observe higher rates of maternal mortality and infant deaths in states with abortion restrictions, particularly impacting communities of color and rural residents. Dr. Bishop, can you explain how these abortion bans and other restrictions on reproductive health care impact maternal mortality and morbidity?
Absolutely, and I think you need to go no further than looking at other states that have enacted abortion restrictions and bans and what's happening in those states with maternal health, maternal morbidity and mortality. I think, unfortunately, many of the states that have come out as being the most restrictive environments at baseline already have the most devastating and surprising rates of maternal mortality and morbidity. They invest the least in the health of women, the health of mothers, the health of children. And I think Florida, we will see much larger, stark disparities moving forward if this ban holds. If there's one thing we know about abortion care is that it is safe when performed in the right environment. We know that it is safer than carrying a pregnancy to term. Accessing an early in pregnancy is one of the most important things to ensure that it is safe. And I think we'll see some devastating consequences down the line.
Yeah, I was going to say, according to the CDC, Florida has a maternal rate of 26%, which is higher than the national average. And how have abortion restrictions in Florida affected the health and well-being of your patients? And do you worry about the long-term effects on the state's already high maternal mortality rate?
I absolutely do. We already have an OBGYN shortage. I mentioned it in my opening remarks. I'm worried about where our trainees are going to end up. Most trainees do not want to end up in a restricted state. I've brought today one of my residents and one of my medical students here because I want them to see this. I want them to experience this. I don't want them to take things for granted as they provide care moving forward. And in a sense, I want to fire them up a little bit.
Thank you. Black, Indigenous, and other communities of color have long experienced systemic disparities in accessing health care and reproductive rights. These disparities, influenced by factors like limited health care access and economic inequality, have led to significant challenges and numerous health disparities among marginalized communities. Miss, I don't want to screw your name up, but Temaraju? All right. These inequities often extend into the criminalization of reproductive health care. For instance, consider the case of Brittany Watts, a Black woman from Ohio who faced criminal charges after experiencing a miscarriage at home in September after significant delays in medical attention. What do you believe are the potential legal ramifications of abortion bans, particularly on communities of color, even rural communities?
You know, I think, well, the doctor covered it pretty well, Dr. Bishop, but I'll add, since you referenced Brittany Watts, that's the case where her miscarriage was criminalized. Look, this is really important to understand, and this is why I brought up Hyde and accessing and expanding care to like immigrant communities as well. Even when Roe was the law of the land, we had criminalization, particularly of people of color in rural communities in tough places. My home state is Texas. I started my career in reproductive rights and advocacy in Texas, and we already had a grave maternal mortality situation, particularly in rural parts of the state where disproportionately brown, not even immigrant, but Latina populations live, right? Currently, one out of every 10 American women lives in Texas, where they have a total abortion ban. So we're already seeing the overall death rates for women of reproductive age are higher among women of color. The pregnancy rates are higher among women of color. The domestic violence and sexual assault correlation is higher for women of color. And the folks who are already marginalized from access to care are more disenfranchised when you have abortion bans. But without access to funding and resources, even passing a federal law won't be enough, because these folks won't be able to access that care, and that was the case when Roe was the law of the land too. Your colleague who couldn't join us today, Congresswoman Lee, is a champion of the EACH Act, and I encourage everyone to sign on if they haven't already.
I have many more questions, but I'm getting the pull. But I just want to thank Ms. Ellador and Ms. Dorbert for sharing your stories. I'm sure it's not easy, so thank you so very much. I yield back.
Thank you.